good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 21st of December. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion today, our last before the new year, is Sophie Wiskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
So for some updated COVID statistics that are not looking very promising, 61% of the population in the United States is fully vaccinated. This number is not increasing every week, which is very, very upsetting. We have a 7-day average of 141,000 positive cases. And yesterday in the United States, we had 298,761 new cases. That is a number that we are close to reaching, about 300,000 cases, which we were seeing last year around this time. Hospitalization and deaths have both increased tremendously, with deaths increasing 40%. And Illinois saw 31,000 cases yesterday, which is a brand new record for Illinois. We in Illinois are seeing about 63% of the population fully vaccinated. Fortunately, in the group of 65 and above, almost 92% of the population is fully vaccinated. What can you tell us about this massive increase in cases over the last week with Omicron, with Delta? What can you share with us, Dr. Murphy?
Well, it was just shortly after Thanksgiving that we saw the data from South Africa. You know, they reported about the virus, and then they had suppressed the number of new infections really dramatically. And all of a sudden, around the 25th or so of November, it just shot up. I mean, there was no curve to the data. It just like was very low, and then 1 week later was like sky high. And that's what we're seeing here. And that's because of Omicron, plus on top of Delta, which is not a good one either. But we've had Delta around for a while. We've been living with it. Omicron is infecting people and doubling every day and a half to 2.5 days. That's at least twice, maybe 3 times as fast as Delta. And so that's why you're seeing these astronomical increases. And it's mutated so much that 2 doses of the vaccine don't even work, basically. And it's so highly contagious. At the same time, it's the holidays. We have COVID fatigue. Everybody's tired of this. This is a universal thing. People are sick of COVID. However, COVID doesn't have a brain or anything. It doesn't really think about anything. It just infects. So it's just replicating like mad. And this is going to go on. It's going to be a very tough couple weeks. Basically, I think every unvaccinated person will get infected. I think it's going to be almost universal. And I think then the vaccinated people, now we should stop using the term booster, really. Excuse me. The vaccinated people have to have 3 doses. That's really what the regimen is. Boosters will come later, but it's not 2 doses and a booster. It's 3 doses. It's a 3-dose vaccine. So not quite as many vaccinated people will get infected, but some of the projections I've seen are that ultimately, because there are more vaccinated people than unvaccinated people, and this thing is so contagious, that maybe more people who are vaccinated will get infected than unvaccinated. However, those who have had the 3 shots are much less likely to end up in the hospital and much less likely to be dying from COVID. So the hospital system is going to bear the brunt of this Omicron wave. And it's already stretching the resources tremendously around the country. And the resources were pretty much stretched with Delta. So this is like on top of that. It's really going to be a crisis. And it's going to be aggravated by the healthcare workers basically burning out from all this intensive care and overwhelming treatment that they're bravely giving. But a whole lot of them are going to get infected too. And then they're going to be out of the system. So we got the ones that are burned out and have left. Then we're going to have the ones that are going to be sick. Having a mild to moderate case still puts you out of commission for at least 2 weeks and maybe longer. It's really, we're going into a very trying time. The only way to slow this down, because this thing is so contagious, now it's more like measles. Measles is highly contagious. And so Omicron is highly contagious. And you have to have a vaccine rate over 90% to control measles. So our new goal really is somewhere around 95%, 90 to 95% people have to be vaccinated. Now, in the background, these mRNA vaccines, the Pfizer and Moderna, are working okay. They're at least keeping you out of the hospital. And both companies are now retooling their vaccine to deal kind of with Omicron here. So but that's going to take months. So it's going to be very tough until a better vaccine comes out. So I would imagine down the road here in a few months, we'll have a better booster shot that will give more protection. But the other thing is, what's after Omicron? I mean, we thought Delta was bad. We thought Beta was bad. Alpha was bad. So this is the nature of this beast. And unfortunately, the United States is not taking it seriously enough. We have some great things that are happening, and then we have some not so great things that are happening. And we have the worst statistics in the world. We have the most deaths. We have the most cases. We have the most political division. We're not alone in the political division, by the way. That's happening worldwide. But it's hurting all of us, because until we get that vaccination rate up high and we get a new vaccine, we're kind of stuck in this epidemic that's just swirling around us. And just in Christmas week, when people have plans to meet and everything, and it's going to be a very tough time. So the recommendations that we have out there, and we've been giving these for months, only meet with other vaccinated people. And by that, people who've had the 3 shots that include an mRNA vaccine. So even if they had Johnson & Johnson, they've got to have an mRNA vaccine booster. So that is a fully vaccinated person. And those are the only people you should be meeting with indoors in any kind of social setting. And that's not happening in restaurants now. That's not happening in bars. That's not happening in many public places. But look at these numbers. I mean, the numbers in the United States almost tripled yesterday. They tripled in Illinois. We got to get serious about this and deal with it. On the good side, we have 2 drugs that are coming out that can treat people at high risk. So molnupiravir and Paxlovid. And I don't understand. They've been approved already. Where are they? The company said they were ready. They need to get out on the market as quickly as possible. There are still monoclonal antibodies out there that do work against Omicron. However, in our own hospital setting, maybe 1 in 4 people that are eligible can get it, because we just don't have enough of them. That needs to be ramped up. And then the usual mitigations. Hey, listen, masks work. 50% effective at least. Social distancing works. We have to get serious about that until we get over this wave. as you've noticed from the beginning of this pandemic, it's not flat, it's waves. So we'll get over this wave and we'll have a little breather spell because everybody will have been infected with Omicron. So remember, with coronavirus, you tend not to get you won't get a second infection in the first couple of months after you're infected. So it'll go down. There'll be some immunity there, but unfortunately with coronavirus, the antibody protection they get, the immunity protection you get does not last that long. And so I don't see why Omicron would be any different. The other ones all been the same. So we'll have a little breather spell there. And by that time, we'll probably catch up with the vaccine. So it's a trying time, but there are things we can do and do safely.
Yeah, definitely. You know, you touched on a lot of various headlines there. And so one of the big headlines you talked about was that Omicron is now the dominant strain of coronavirus in the US. It accounts for nearly 73% of all new cases in the last 3 weeks. You know, what can you tell us about this massive increase? And we went to like 16 cases to 46 cases to now it accounts for about 200,000 cases in the States yesterday.
Well, remember, it's exponential growth. So you don't go 2, 4, 6, 8. You go 2, 4, 8, 16, 32, 64, 128, 256. You know, that's how it goes. So it's exponential increase. And that's why the South Africans, we didn't even see any curve. It went like in 1 week, just like took off like a house on fire. And the same thing is happening here. And, you know, we went from 2.9% Omicron just a little over a week ago to 73%. I mean, wow.
Yeah, it's very sad.
Yep.
One of the other big COVID headlines of the week is that the Moderna says booster is effective against Omicron in their new tests. They will develop a new shot. So why are they going to develop a new shot if it's effective against Omicron? This is a big confusion within the United States.
Yeah. So the increase in the antibodies, that's just one part of the immunity, but it's a signal, and it's only protecting from severe disease. It's not protecting from infection. So in other words, a lot of people getting sick and they're out for a couple of days. They have to quarantine, isolate for, 14 days, and then, they're back. They're not that sick. So that's great. And so that really helps. Both Pfizer and Moderna, at both of the doses of the Moderna vaccine, 50 microgram is the booster dose and 100 micrograms is the main dose of the first 2 shots. And you get this remarkable increase in the immunity. Pfizer was 25-fold. But remember, they're completely different studies, so it's a little bit apples and oranges. Those are both phenomenal increases. It's not 25%, it's 25 times. So if your antibody level is 10, it goes up to 250. That's huge for a 25-fold increase. But anyway, so that's very reassuring. And that's what's going to save us. That's what's going to save most of the people in the population, the 50 or 60% or so people that have taken the vaccine. But you've got to be boosted. This data is really powerful. If you haven't had your booster shot, get out there and get in line someplace and get it. And get either one of them. It's just no time to mess around here. It's just too critical.
Yes, definitely. And now for a difficult headline, especially as this hits close to home on my end. Colleges are moving exams online, and they're also moving many weeks of their, beginning of second semester, beginning of winter quarter, are moving online, and they're urging as many students as they can to get boosters as Omicron fears are growing. What can you tell us about colleges going online, Dr. Murphy?
It's almost too late, but it's essential because look at this. I mean, Cornell, 1,100 students tested positive in 1 week. GW, another one. We're having more cases now at Northwestern as well. They're mild, but it's just like all these people, you know, everyone at Northwestern is vaccinated, and I'm sure these other schools are the same. And they're just, it's like they're not even vaccinated. There's cases all over the place. So it's going to be tough. And, you know, Northwestern is on the quarter system. They start early in January. I'm not privy to the, you know, what happens at the undergraduate campus, how they are going to handle it, but I'm sure it's on their agenda for today. It's really going to be, it's going to be a little bit crazy. So, you know, you got to, whatever school you're at, if you're a student, you got to look at this day by day. You know, that you're going to be getting messages what to do, you know, to set up this whole online thing, you know, with like a little over a week to go, you know, it's really, that's going to be a challenge. But, you know, you got to do what you have to do. And you can do things relatively safe, as I said. It's not the end of the world.
Yeah. No, agreed. And now for some COVID questions from the public.
Okay.
Is it possible that Omicron variant is actually a common cold variant and the COVID-19 virus is mutating itself out of existence? Can you tell us a little bit about how to understand this question?
That could certainly happen. It could become a common cold. It could mutate to highly transmissible and not cause much disease. That hasn't happened yet. So who knows if that's going to happen. But all pandemics do end. And how this one is going to end could be something like that. Right now, that's not happening. So, you know, we get the reports from South Africa that the disease appears to be milder than Delta and Beta. They had more Beta, they had a lot of Beta down there. But anyway, it seemed to be milder. And they've reported that, and those reports have held up in Pretoria and Johannesburg. However, a study just came out 2 days ago, which in this thing means, you know, 8 replications ago, whatever, is that they're not seeing any difference, and the hospitals are getting overwhelmed with Omicron. So that we'll have to see what that is. The whole thing is so new. Remember, it takes about a month to really clog up the hospital system because you get infected, takes about a week to get symptoms, and then the high-risk people, you know, get sick over the next week and end up in the hospital, and then in the hospital they end up in the ICU, and you know, it takes a while for that whole thing to go. What you're seeing now with the hospitalization and the increased death rate is primarily Delta. So, you know, Omicron's on top of that. So, you know, this wave is projected to go way up.
Right. And now for our second COVID question. This person has a history of ITP, and it has been very bad for over 20, it was very bad 24 years ago, where their pallets were about 11,000. The doctor suggested that they stick with J&J, which they received. They're waiting for the J&J booster. It is now showing in studies that Pfizer is known to trigger ITP, and a patient has died about 3 weeks ago with ITP. Do you suggest that they just stick with the J&J vaccine as their doctor suggested?
Well, okay, I'm not a hematologist, and I would stick with what the hematologist is recommending. This is a personal decision between your expert doctor and this person needs an expert. It sounds like they have one. But remember, the J&J vaccine, you can boost yourself with the J&J vaccine. You only have to wait 2 months. Don't wait 6 months.
Right.
But the J&J over 2 months ago, get it like the booster right now. You'll get more protection that way. And there has been some studies that have shown, not with Omicron, but with Delta, that the cellular immunity works very well with the J&J vaccine. So not the front end antibody part, but the heavy duty part that protects you from severe disease. So I think that's a reasonable approach, but I leave it up to the hematology experts.
Wonderful. Now for our third question. This individual heard on WGN that they mentioned that the Pfizer vaccine does not work as expected with children. Are there other options for kids that we should go with? They have an 11-year-old and a 9-year-old, and they have their Pfizer vaccines scheduled for them this week. Should they hold off? Should they get Moderna? What are you seeing with the effectiveness in children?
Yeah, so the Pfizer vaccine has been studied in kids 5 to 11. They get 1/3 the adult dose, 10 micrograms, and that worked fine. So for 5 to 11, there's really no question. What we're referring to when we say kids, we mean really little kids. So there's another study with 6 months to 4 years of age. They got 2 doses of the 3 micrograms. So the adults get 30, the older kids get 10, and then the little kids were getting 3. And they found after 2 doses, it wasn't producing enough antibodies or immune response, however they were measuring it. So they are looking at the impact of a 3rd dose, and then they're going to have to go back and maybe give a bigger dose. And that's just Pfizer. So Moderna has their own parallel studies going on. So it's just the vaccine that's not approved yet anyway. You couldn't get a vaccine for a kid under 5. And so that study was a disappointment, but this is why it's called research. You know, we have to study these things first to see if it worked before we, you know, put it out into the public. And you know, that's the way it goes. Research is research. You know, that's why we do it.
Right. And this individual would like to know that they have families that work in the healthcare system and are exposed to COVID every day. They are concerned about putting themselves at risk, especially for the holidays. Should this family wear masks while they are indoors? What are your thoughts? All these individuals are vaccinated.
I think anybody who's exposed to a lot of COVID people, even if you're wearing a mask, remember masks are 50% effective. This thing is highly contagious. 50% is small. We're talking like 2-3x, 200-300%, you know, more contagious. So I think, you know, if you want to be safe, that you know, masks indoors is the way to go. I mean, it's just it's all about risk. How much risk are you willing to take to be together in the same room? I think people are just getting used to wearing masks more in some parts of the country. Kids certainly are. They go to school, put their mask on, and they've kind of just adjusted. So I think in this particular case, it would be the safest.
Right. Now for a last and final COVID question. Yesterday, Northwestern sent out an email to students and faculty, especially for the undergraduate campus, that there will be remote learning for the first 2 weeks and that in-person learning will be on January 17th. Do you think that it will truly be 2 weeks of remote learning with how the numbers are looking right now? Or do you think that we will be online for the rest of the quarter?
I have no idea. I would hope that a couple weeks would be enough to kind of turn the tide and get this thing going down. But we'll see. It's going to be a day-to-day type thing.
Definitely. Well, thank you, Dr. Murphy, and Happy New Year, everyone, for everybody listening, and happy holidays.
Right.
We will see you guys back in the
Okay.
early January.